Hello everyone, welcome to Nursing Arena. My name is Kritika Andora and today we are going to discuss some of the important questions of nursing. Let's get started. First question. In majority of the cases, the causative organism for sore throat is gonococcus, staphylococcus, meningococci or streptococci. The causative organism for sore throat is streptococci. Next question. Which of the following method of contraception can prevent sexually transmitted disease? Oral pills, condom, copper T or cervical cap? So, the correct answer which prevent the sexually transmitted disease are condom. Condom is a type of barrier method which prevent the sperm to get into the vagina. That's why it prevents sexually transmitted disease. Next question. Which one of the following vitamin helps in wound healing? Vitamin A, vitamin B, vitamin C or vitamin D? So, the correct answer, the vitamin which helps in wound healing is vitamin C. Vitamin C, also called as ascorbic acid. Next question. A patient is receiving external beam radiation of metastatic endometrial cancer. The treatment of metastatic field includes the entire pelvis. Which of the following tissue within this radiation field is most radiosensitive? Vagina, ovary, rectovaginal septum or bladder? So, the correct answer is the most affected organ in the pelvic is ovary. Ovary is the organ which affects most to the radiation. Next question. Filaria is caused by bacteria, protozoa, fungus or virus? So, the correct answer is filaria is caused by protozoa. Next question. The first evidence of pubertal development in female is usually manifest as onset of menarche, appearance of breast buds, appearance of axillary and pubic hairs, onset of growth spurt. प्यूबर्टल डेवलपमेंट के दौरान फीमेल के अंदर यूजुअली जो फर्स्ट चेंजेस होते हैं वो कौन से होते हैं? सो द करेक्ट आंसर इज appearance of breast buds. That is the first pubertal change in the female, which is usually manifest. Moving towards next question. Which of the following neoplasm has been associated with the use of oral contraceptive? Breast cancer, ovarian cancer, endometrial cancer or hepatic cancer? So, the most usual cancer which occurs from oral contraceptives is breast cancer. Next question. Which of the following is not an oral contraceptive pill? Estrogen only mini pill, estrogen and progesterone combined pill, estrogen followed by progesterone sequential pill, or cortisol only pill? So the correct answer is, for that which is not an oral contraceptive pill, is cortisol only pill. Next question. Temporary hardness of water is removed by boiling, filtration, Sodus method, or addition of chlorine. So the correct answer which removes the temporary hardness of water is by boiling. Next question. Which of the following statement is most appropriate to convince a mother for immunization of her child? Immunization is okay for your baby. Vaccines are expensive and you are getting it free. Vaccines will prevent the occurrence of that disease in future for which it is meant. Government will take of all post-immunization complication. So, the correct answer to convince a mother for immunization of her child is vaccines will prevent the occurrence of that disease in future for which it is meant. So, next question. Which one of the health services is not available in rural health unit? Maternal and child health work, communicable disease control work, environmental sanitation work, or cancer treatment facility? So, the correct answer, the services which are not available in the rural health unit are cancer treatment facility. Cancer treatment facility requires highly specialized services which are not present in the rural health unit. Next question. During the delivery, the perineal tear extends through the sphincter of the rectum, but the rectum mucosa is intact. How would you classify this type of perineal tear? First degree, second degree, third degree, or fourth degree? The correct answer is, this is the type of third degree tear, because the rectal mucosa is intact. That's why it is considered in the third degree. Next question. Compared to the use of vacuum extractor, forceps delivery is associated with increased risk of minor facial injuries, cephalohematoma, retinal hemorrhage, or intracranial hemorrhage. So, the correct answer, that is forceps delivery, is associated with risk of minor facial injuries. Next question. Mitosis is a condition of cell breakdown, cell division without reaction, cell death, or cell division with half of the chromosomes. So, mitosis is a condition of cell division without reaction. Next question. Which of the following response is expected in a mother suckling the baby? Increase of adrenaline, increase of prolactin inhibiting factor, increase of hypothalamic dopamine, or increase of oxytocin? So, the correct answer, which is the following response, is expected in a mother suckling the baby is increase of oxytocin. Next question. Malaria transmission occurs by vector, food and water, airborne, or fomites, that is inanimate object. So, the correct answer is malaria transmission occurs by vector. Vector is a source which transmits infection from one thing to another. We can find that malaria, which is caused by a mosquito, that is female Anopheles, work as a vector to transmit infection from one person to another person. Next question. Which one of the following brain area that regulate body temperature? Cerebrum, cerebellum, hypothalamus, or hippocampus? So, the correct answer, the area of the brain that regulate the body temperature is hypothalamus. Next question. What is the best method to dispose hospital waste? Composting, dumping, chemical treatment, or incineration? So, the correct answer, the best method to dispose hospital waste is incineration. Incineration is a type of burning method in which we burn all the waste and only the left part is ashes, which is non-harmful to the humans. Next question. Blood drawn for complete blood count, that is CBC, is collected in EDTA vial, plain vial, citrate vial, or chloride vial. So, the correct answer, the complete blood count is collected in EDTA vial. Next question. Cell with a horseshoe-shaped nucleus and abundant cytoplasm in a peripheral blood smear is neutrophil, monocyte, lymphocyte, or eosinophil? The correct answer is the horseshoe-shaped nucleus and abundant cytoplasm in the peripheral blood smear is monocyte. Next question. Thrombocytopenia stands for weakness of platelet aggregation, reduced platelet count, increased platelet count, or normal platelet count? So, the correct answer, thrombocytopenia stands for reduced platelet counts. Thrombo means platelet and cytopenia means decrease. So, in body, reduced platelet count is termed as thrombocytopenia. Next question. All of the following are signs of anorexia nervosa except frequent eating habit, dry hair and skin, fatigue, or anxious and hopeless look. So, the correct answer, the following, the signs of anorexia nervosa except are frequent eating habit, because In anorexia nervosa, it is a type of disorder in which person lack of appetite. So, he or she does not have frequent eating habit. Next question. Benzodiazepine reduce anxiety by acting on which neurotransmitter? GABA, serotonin, noradrenaline, or dopamine? So, the correct answer is benzodiazepine reduces anxiety by acting on GABA neurotransmitter. Next question. The most effective psychotherapy for a 9-year-old diagnosis with attention deficit hyperactivity syndrome ADHD is play therapy, myelotherapy, behavioral therapy, or family therapy. So, the correct answer, the most effective psychotherapy for a 9-year-old diagnosis with attention deficit hyperactivity syndrome is behavioral therapy. Next question. All of the following are true about nursing care for a patient with delirium except allow the client to wear his/her own clothes, avoid room changes, especially at night, refrain family members to stay with the patient, and avoid physical restraint whenever possible. The correct answer is true about nursing care for a patient with delirium except refrain family members to stay with the patient. Thank you for listening this. These may help your knowledge.